And I want to go now to Dr. Jamin Brahmnbhatt, prominent urologist, surgeon based in Florida. You can see his TED Talks as well. And Dr. Brahmnbhatt, I really appreciate your time. So this is going to be the fourth night in the hospital. Americans understand, given the state of medical care in this country, being in the hospital for 4 nights is generally speaking an incredibly serious thing. You're not even in the hospital 4 nights when you have a C-section. How serious of an infection is this?
I mean, sepsis, when you're diagnosed with it, is as serious as it gets. And once you get that diagnosis, time is of the essence. So you saw the president was getting hydration and fluids and antibiotics. The quicker you start initiating treatment, the better chance the patient has of surviving the overall symptoms of sepsis. Because sepsis has degrees to it. You have sepsis, then severe sepsis, and then septic shock. The shock is where all the organs start failing, and that's what we're trying to prevent. So it's pretty serious. If you have even mild symptoms and you have any concerns, you should definitely get yourself checked out sooner rather than later.
Yeah, and I think what is frightening to a lot of people about this when they think about it is, he's otherwise healthy. I mean, obviously, he has had heart conditions, but, he's otherwise a healthy person. He just feels fatigued. And all of a sudden, wait a minute, you're in the ICU. And I know that was partly for security reasons, but, you're there for something that could be very serious. I understand that the cause of this, in his case, the specific cause of a urinary tract infection is not common in men, but more common than many people may actually think. So tell me about how common it is and what people should know.
So over a lifetime, a guy has about a 12% chance of getting a urinary tract infection. But you mentioned something very important. You don't have symptoms all the time. In my office, I probably see a guy once or twice a month that we find infection based on a urine test that was done as a screening test. So that's why it's very important for men to go and get their preventative screenings done, especially men. And these are the high-risk individuals that will have complications from any infection. Men over the age of 50, men that are not emptying their bladder, that have prostate issues, men with mobility issues, so they're just not as active, so their body's just not as strong as we need it to be overall, and men with chronic conditions like really bad heart issues or uncontrolled diabetes. All of these risk factors make you more prone to getting infections, but not just infections, but more prone to getting some of these severe infections.
So obviously you mentioned how deadly sepsis can be, right? That once you're in that state, it is as serious as it gets, I think was the exact phrase you used. I know that according to the CDC, 270,000 people a year die from sepsis. How common is it for someone to develop a UTI and have it turn into sepsis? Or what is the predominant drivers of sepsis?
I would say it's extremely rare. Once you have symptoms and you start initiating treatment, actually, I see a lot of men in my office that have rip-roaring urinary tract infections. They will never get to that point of sepsis. Sepsis sometimes can be predictable and sometimes it can be unpredictable. And that's why you just have to be aware of your symptoms. If you start having issues breathing, if you start having issues with your blood pressure, or if you start having this excessive fatigue or anything that may feel abnormal, you got to get yourself checked out. And I think that's why men sometimes suffer more severe complications, because they just don't have those symptoms. And when they do have those symptoms, they may just say, okay, maybe I'm tired, or maybe I just drank something, or maybe I'm dehydrated. But, it could be something inside of you. And that's why it's really important to go and get yourself checked out.
All right. Well, doctor, I really appreciate your time. Thank you so much.
Thank you, Erin.